Well, I've worked extensively with the geriatric populations. Plus, I have a mother and a grandmother who is on Medicare, and I know they're both concerned. They hear a lot about the $716 billion that's being taken out by Obamacare, ostensibly. So, can you talk a little bit about that?
Yeah, it's a great question, and it's certainly a very timely one. So this $716 billion number has been thrown about a lot, and that is a real number. And the way that that number comes to be in Obamacare is in several different ways. First of all, and most important to reassure your mom and your grandmother, is that it does not come from cutting benefits to Medicare enrollees. So it doesn't affect the benefits that seniors are receiving right now at all. What it does do is it reduces overpayments to private health insurance companies that sell these, they're called Medicare Advantage plans. And it's interesting how this developed over time. There are private health insurance companies that sell basically Medicare, but they're called Medicare Advantage plans. And they're a little different than traditional Medicare. Some of them offer the prescription drug benefit, for instance, rolled up inside of them and things like that. But the private health insurance companies are getting a subsidy to offer those plans to seniors. And to the tune of about, for the individual taxpayer, it costs us about 11 to 15% more per Medicare beneficiary who purchases a Medicare Advantage plan than traditional Medicare. Now, the Congress decided that there just needed to be a level playing field there. So over the next several years, these extra payments to Medicare Advantage plans are going to go slowly down, so that in a few years, Medicare Advantage and traditional Medicare will cost taxpayers the same amount of money. Seniors will still have total choice. You know, once a year, a senior can make a choice of which way they want to go, traditional Medicare or Medicare Advantage. That choice remains, but the taxpayer cost will be equivalent. What's important to remember is that these Medicare Advantage plans are being held to that same medical loss ratio that we heard about earlier. And so what we're seeing in the Medicare Advantage plan market is that premiums are either holding stable, or in a couple cases they've actually gone down a tiny bit because that medical loss ratio applies to them as well. So that is a significant piece of that $716 billion. Another effort that's underway is that the Obama administration is making really significant inroads in reducing fraudulent billing in the Medicare system. And in fact, last year they collected, you know, it was I think $4 billion in 1 year they recouped in fraudulent billing. And then the remainder of it is a slowing in the rate of rise of reimbursement to hospitals and pharmaceutical companies and doctors. So they're not cuts to those reimbursements. It's a slowing in the kind of the slope of the curve. And so in total, that's where what it adds up to $716 billion. So from a senior's perspective, their benefits are secure, and in fact, they're more secure than they were before the Affordable Care Act. Because prior to passage of the law, the Medicare Trust Fund was projected to run out of money in 2016, and now it's good 8 more years on top of that. So we're solid, you know, well into the 2020s. And so it's actually made Medicare much more secure for our seniors.
It seems as if there's a lot of confusion about that issue.
Well, I think some of the confusion has come up when the House of Representatives passed their 2013 budget plan last spring. This is the plan that's sometimes referred to as the Ryan Plan because Congressman Ryan is chairman of that committee. That plan takes a very different approach to Medicare, but it also has that same budget number in it of $716 billion. So the difference is the way that that number is achieved. And what the House 2013 budget plan would do is mostly privatize Medicare. So there would still be the option for seniors to buy into traditional Medicare, but seniors would be given a set amount of money. It's called premium support. Some people are calling it vouchers, but the technical name is premium support. They would be given a set amount of money that they could use every year to go out and buy a private health insurance plan. And where a lot of that $716 billion of savings comes from in the House budget plan is that over time, the amount of money that the senior would receive would not go up as quickly as the anticipated cost of the health insurance plans is going to go up with just inflation. So that over time, year over year, seniors would have to pay more and more and more out of their own pocket to actually purchase their health insurance. So it's pretty clear that seniors' direct costs would go up under that scenario. So in the first year, wouldn't be a whole lot different than the current situation, but the concern for seniors is over time, the amount of money that they have to come up with of their own money would really dramatically increase compared to what it would look like under the Affordable Care Act, where seniors have much more financial protection under that scenario.
Yes. How about drug costs?
Yes. A very, very important provision under Obamacare is to close a gap in the existing Medicare prescription drug plan. And that gap is often referred to as the donut hole. And what that means is that prior to the passage of the Affordable Care Act, when a senior hit about $2,900 of total drug costs in a year, they fell into something that was called the donut hole. And that meant that they had to pay 100% of their drug care costs until they reached about $6,200 in total drug spending for that year, and then the Medicare plan would kick back in. So what do you think seniors did when they were in that donut hole? Some of you may have family members who had this experience. They would start cutting their pills in half. They would start taking them every other day. Seniors on fixed incomes simply cannot afford the cost of a lot of these medications. So under the Affordable Care Act, that donut hole is starting to close. And right now in 2012, what's happening is as soon as a senior gets into that $2,900, $3,000 range of spending, automatically they will get a 50% discount on any brand name drugs. So when they go to the pharmacy, they're still going to have to pay more, but at least it's a 50% discount. And they get a 14% discount on generic drugs. And between now and 2018, those discounts keep getting bigger, so that by 2018, it's a straight, throughout the entire year, 25% copay, which is what they pay before the donut hole. So that's going to be huge because seniors can now budget. They know what their drug costs are going to be, basically, and they can, save that money hopefully, and at least know what they're facing over the course of a year. And so that's just critically important because if seniors can stay on their medications in a stable way, it keeps them out of the hospital, keeps them healthy, and it reduces healthcare costs for everybody. So it's pretty important.